There are two different types of implants, basically. There are implants that are filled with saline, which is salt water, and there are implants that are filled with silicone gel. Not many doctors will recommend saline implants these days because the saline implants don't look and feel as good. They tend to ripple, particularly as they get older, and that gives a kind of waterbed effect, waterbed feel, and sometimes a waterbed look with actually seeing the rippling through the skin. Silicone, of course, has a bit of a checkered history, and over the years it's been thought that it might make people ill or make people sick, or whiz around the body and cause different kinds or exacerbate different kinds of diseases. We now know that that is completely untrue. It doesn't do any of those things. There were problems, though, with leaking silicone, particularly in the early generations of implants, because they were thin and flimsy and filled with a silicone gel that was too liquid. So not only did they break more often, but when they did break, the gel could run out. This caused localized problems in and around the breast, where the body would wall off leaking silicone and form lumps called granulomas, bits of scar tissue to wall off the silicone effectively. Now, these aren't dangerous, but they're a nuisance, and if they're big enough, they could become painful. Around about 15 years ago, two things happened. First of all, the covering of the implant was made much stronger, so it's less likely to break. And secondly, and very importantly, the gel was thickened up. It's called technically cohesive gel, and it looks and feels a bit like Turkish Delight. It's also known as gummy bear implants. That's exactly the same thing. There's no difference between a gummy bear implant and a cohesive gel implant. If these implants leak, because they're like Turkish Delight, the gel doesn't run out in the same way. You can still get leakage, you can still get granulomas, but it's much less of a problem than it used to be.